information included on there, but I don't intend to go in depth on every part of that. I thought what I would focus on is just mainly what the basic components of an assessment are, and especially what some of the tests measure. And I'm certainly willing to answer your questions as we go, or at the end, either way. So I guess I'll go ahead and get started. I'm a licensed psychologist, and I've worked here about 30 years, and I do primarily testing. Of course, we test all the new enrollees. We usually do that to give the teachers information about their skills and their abilities. But then we also provide outside diagnostic services too. And we see people from ages, 4 all the way up to adults for a variety of reasons, but usually it's related to learning or attention problems, some kind of learning or language difficulty. So I'll go ahead and start, and as I say, as we're going, it's okay if you want to ask questions. And so I'll just go ahead and start by, you probably heard the term assessment, and you probably heard testing, but really an assessment is more than just testing. Testing is just probably the main component of an assessment, but an assessment is really collecting a lot of information, to determine where a child's strengths are and weaknesses, and of course what kind of interventions they might need. And it usually includes testing in these areas: intelligence and information processing. And keep in mind that intelligence and ability testing, it kind of overlaps with information processing. It's usually, what I'm saying is that a lot of the subtests on a lot of the parts of an IQ test also measure information processing, like memory and speed of processing, and of course also how well you can just express information, because you have to answer questions on IQ tests as well. And then the other major component is academic skills, and that's of course reading and math and written language. And then attention, and attention is usually assessed by, certainly the most important thing is by interviewing the parents and getting a history of how things have played out, and then using questionnaires and rating scales from the teachers and the parents, and if the kid is old enough, having him or her do rating scales. And then also, there are some computer tests that supposedly measure attention, and they're usually computer-based tests that require a student to sit down and stick with something and not be impulsive, and they measure how quickly you're responding, whether or not your attention waxes and wanes, whether you just stop responding because you space out. So those tests have some validity, but I found that as the years have gone by and kids are more and more involved with computers, it seems like even though that test is really, usually those tests are intentionally boring, a lot of kids can still do them just because it's on a computer. So you can have a kid who's totally, totally hyper, or inattentive all the time in class and at home, and yet they can sit down and do this boring test just because, well, I've never done this test before, so they can often get through it and the test results look fine, and yet the results probably don't mean very much. That happens a lot. We use it though, especially for older kids, just to see if they can stick with it. And then you also look at emotional and social and behavioral functioning, and of course that's done partly by interviewing the parents and asking them questions about those areas, but also rating scales pick up on those areas of functioning as well. And how many of you have ever had to fill out rating scales on someone? Or you've just had to? Okay, so you can see that you can probably kind of pick up on the patterns. Some of the questions are kind of repetitive, but maybe worded differently. But most rating scales, after they've been filled out, then when you score them, the questions fit into categories like, aggression, rule-breaking behavior, inattention, depression, anxiety, and then the scores tell you whether those areas are elevated in a way that's really out of the norm for compared to how kids usually respond. So that's how they're used. So that's what rating scales do, is they put behaviors into categories, and they tell you the magnitude of the or the severity of the behavior. And I know I'm sure you're aware that there's different types of assessments, and there's neuropsych evaluations, and I guess some of the things we do kind of overlap, but I'm not a trained neuropsychologist. But neuropsychology usually involves brain behavior relationships based on the test results. That tells you how that part of their brain functions, or some process in the brain is how well it's operating. And psychological evaluation focuses more on, you have areas of language understanding and visual spatial processing and visual discrimination. I don't try to, whenever I assess someone, I don't try to relate it to a specific part of the brain, but I do say, these are memory problems, and therefore here's how they should be addressed. So you may get a little bit more, on a neuropsych exam, you may get more explanation of what's going on neurologically. And then a psychoed evaluation is a combination of, psychology and the academic piece, reading and math and written language, and that's basically what we do here. It's, part psychology, part educational. And then you have public school assessment, which really is partly a psychoeducational assessment, except the goals are usually different. The goal is to determine placement or eligibility for special ed. So the approach to the assessment is often a little different, because if a kid is not eligible for services, that may often be the end of the assessment. It's not like they say, here are 25 recommendations to consider based on the assessment. It's like you don't qualify or you do qualify. That's not to say that public schools might not, they might make suggestions, but it's not, usually the assessment kind of ends there after if a student has been found not to be eligible. And there's another type of assessment that I didn't mention, and that's reading. I know there's reading specialists who do assessments now, and really I've read some, and they're really pretty good. I mean, they've been trained in reading, and they often focus on, they usually have a teaching degree, or they have a degree in reading, and I see some of the things that they give, and they're really good for identifying dyslexia. And so a lot of people, whenever they hear that term dyslexia, they think of, that's a medical diagnosis. And I know parents will go to the schools and ask them if they will, can you diagnose, or can you see if my child has dyslexia? And often the public school will say, no, that's a medical, have you heard this before, that it's a medical diagnosis? And really it's not. It's a clinical diagnosis, or even an educational diagnosis, because the instruments you use, we'll talk about the instruments you use, but part of it is just administering reading instruments, but then also looking at phonological processing, phonological awareness, auditory memory, auditory sequencing, and those tasks can be given by, those kinds of tests can be given by a reading specialist. So I think I've seen some reading specialists who just do assessments. Is anyone here a reading specialist? Just exclusively, or do you do assessments, or?
I used to basic ones, yeah. I don't think I'm in depth. I work for Minnesota Reading Corps. So they just trained us on some basic ones, initial ones for K-3.
Yeah. Okay. All right, so those are the different types of assessments, and usually a good assessment should be conducted by a qualified professional, and usually is, now some of this relates also to adults or students going off to college. They often want to see the assessment has to be current, it has to be comprehensive so that you can come up with a diagnosis, and usually it includes relevant historical information, and that's usually collected either by the interview with a parent, or report cards, previous test results, relevant medical records. So that's all part of the assessment. The assessment is all this collecting of data, and whereas the testing is just one component. And it's also, especially if you're going off to college, the history of accommodations used in the past is good information to have as well, whether they've had